to the virus? In what
Well,
environment?
at one point or the other, I knew I was going to get exposed. Where I work, I see patients on a daily basis, and before the whole thing became so full blown, I had seen one or two patients who came in with similar symptoms. But at that point in time, the whole essence, emphasis was not as strong as it is now. And then a few times we had not completely closed the clinic,
Yes.
so I saw one or two, but I was careful not to get exposed. But that was weeks before. And then I went up on the floors where I went to cover for some of the doctors who got sick as well.
Yes.
So I guess one way or the other, I got exposed somewhere. And then, it happened.
Yes. Yes. Yes.
Yes,
I'm listening to you. So,
yes. So go ahead.
but when you went to see, when you were taking care of the patients, you had your PPE on because there's no way you can see a COVID patient without full PPE.
Well, the essence is this, right from the beginning, because this was, right from the onset of which, things were coming up, and we had still grappling around, how to handle a lot of all these issues. Now, at the hospital, they are separated COVID positive
Hmm.
and COVID negative patients.
Yes.
But as you and I now know,
Hmm.
there are people who are asymptomatic
Yes.
that that secrete the virus, or,
Yes.
with the virus, but people don't know that. But they're asymptomatic, but they do have the virus until they begin to start getting symptoms.
Hmm.
So a lot of those ones, you get exposed, and that's why it's particularly difficult for those in the healthcare system. And of course, we know patients move from one hospital to one hospital. I know of a particular case of a lady who was, exposed in another hospital, tested positive in another hospital, but then came, to our hospital, and we didn't find out until we had to call the other hospital to find out. So by then, you find out people have been exposed already.
Yes.
You know.
Okay, doctor. So, along the way, you caught the virus. Somebody you were exposed to the virus. So, what were the first symptoms you noticed?
Well, I mean, initially, if you remember, this was way still in March,
Hmm.
and all through March, the flu season was still on, and a
Yes.
few of us had gotten a few. I think I had traveled to Florida for an event, and I came back, and I think I had the flu, little aches and pain here and there. But
Hmm.
then that went away, and I was telling somebody like, "Oh, I feel so great. I exercise every day. I'm not on any meds. I take my multivitamins. I try to drink as much water as I can.
Yes.
I eat as much as I can." But then all of a sudden, I started having, a few aches and pain here. But what struck me particularly was I was coming back from work one day, and then I had this horrible sharp pain in my left knee. I'm like, what's going on with my knee here? This sharp pain, like somebody used a sharp needle and just stuck me there.
Hmm.
So, but I got into the car and I said, okay, did I sprain my knee? But by the
Yes.
time I got home, the whole knee was hurting, and then my whole body was hurting, and all of a sudden the fever started, and that
Oh.
fever persistently for went on. Initially it was a 99, 100, 101. It went up to 104, and with general aches and pain. I mean, people ask me because over the phone when we triaged and took care of patients, I've had patients complain with different symptoms.
Yes.
So we're getting familiar with a lot of the symptoms that they have. Some will just tell you, oh, it's a loss of smell,
Yes.
especially with women. A lot of women just complain, oh, loss of smell, and that's it. And then some will have, loss of smell with loss of taste and then cough. And
Yes.
some will just have the dry cough. I remember people saying, oh, the dry cough, the dry cough.
Yes.
And then subsequent people have aches and pain and
Hmm.
fever that eventually goes on to be high grade fever. And then you have people who would have diarrhea. As a matter of fact, in my experience and people around me, most of the people who had diarrhea were women. And those are the people who lost the sense of taste or smell were also women. And most of them, that's the only symptom that they had. They didn't even have no fever. So, but for me, I had the fever and then the weakness. A few
Yes.
people had described the weakness.
Weakness.
A few patients of mine have said, you know what, the weakness is unbelievable. You just want to sleep and rest, because that rest and that sleep feels so good. It wants to make you feel so good that you rather. In fact, somebody had actually described it and said that you rather sleep than not do anything else, because when you do, you feel so good.
Mm-hmm.
But he said, please do not go to bed, because that's the sleep of death.
Oh,
And when the COVID was coming to New York and Jersey, and we're seeing patients with that, I pay because when you listen to patients, you have to take cognizance of some of the signs and symptoms that they present, so
yeah.
that when you see these things in a constellation, you'll be able to make up your mind about what the diagnosis you want to make up. So when I took care of patients who had those similar symptoms, I could recognize that.
Mm-hmm.
And I quickly told patients, like, listen, please, no matter how weak you feel or tired you feel, don't lie down. And if it's possible, when you lie down, try and see if you can try and get up to eat or do something. Because if you don't, then you feel weaker and weaker. In fact, there's what they call disuse atrophy in medicine. In common terms, they say if you don't use it, you lose it. So if you
Mm-hmm.
don't use your muscle, you begin to lose your muscle mass. So the
Yes.
more you lay down, the more mass and weakness you begin to observe. So I usually, in fact, a few of them who I taught them on the video stuff. There are some of the exercise to do so that they feel active and feel well. But I tell people this also: always try and get somebody who would, ask of you, find out what you're doing, and then because you're so weak, you cannot eat. Now, when I had my symptoms,
Mm-hmm.
the aches and the pain, and then subsequently the weakness came.
Yes.
Lord have mercy. The same weakness that people described, I felt it. With the aches and pain, when you're sick and you want to you lie down, you don't feel comfortable. But this one, you feel so comfortable. That's just what you want to do.
So people just sleep and sleep away.
You just sleep. I mean, if you could leave me, I could sleep for 15 hours. I swear. The only thing that wake me up, I eat, I go to bed. The weakness and the sleep, it's unbelievable.
Yeah. Okay. So
Unbelievable.
what do
And
you
people
do?
have
Like you
described it.
drink coffee through it? What? How do you make yourself stay up? I mean, I would
Well,
know
you
that
just have to, in
it's
all sincerity,
really
I had
hard.
to be woken up. I had to be woken up.
Oh, you
My
have people
wife, God
wake
bless
you
her,
up.
she's a nurse. God bless her, she's a nurse. So she had to, wake me up.
Yeah.
Get up,
Yeah.
eat. So get up and do, the whole, treatment therapy, take your meds and all that, because you just want to sleep.
Yeah.
And what's his name? Chris Como had actually described it as well. He said, the way he described, he said, the sleep the virus wants to make you sleep,
Yes.
and the sleep feels so good so that it can get into your lungs,
Oh,
because
wow.
then that's when most of the people who get who are exposed to virus, a
Mm-hmm.
large majority of them don't have symptoms. In fact, there are
Mm-hmm.
actually percentages that don't have symptoms, and for those who have symptoms, some of them are just mild. A few others have severe symptoms,
Mm-hmm.
a little bit that I've had. Now, others with a cough and the sore throat progress to, respiratory problems,
Mm-hmm.
and eventually, oxygen being low and going to the hospital. And then, the sad part with that, on unprecedented or unpeculiar sleep is
Mm-hmm.
this. Normally, for you and I, as
Yes.
we're awake now, your heart
Mm-hmm.
rate is up when talking. It goes up to 100, 120, 140. Your
Yes.
respiratory rate that is usually, maybe 15 or to 18, goes up to 22, 23. Your pulse ox, that's the amount of oxygen in your body,
Yes.
usually ranges from 97 to 100 as we breathe in and talk and all that.
Yes.
But ideally, when you sleep, as you're sleeping, everything calms down. The brain calms down. Everything calms down. So your heart rate also drops. So
Yes.
if you have an average heart rate of 80s or something, it drops down to the 70s and sometimes even to the 60s.
Mm-hmm.
And then the respiratory rate that is usually 18, 19 drops down to as low as, for a few people, 14, 15. Now, when all of those things drop, your pulse ox, which is the amount of oxygen in your blood,
Mm-hmm.
also drops. And like I said, if you're awake, 70 something, sorry, 90 something to 100, except for those who have respiratory problem from
Mm-hmm.
severe COPD or severe asthma or severe restrictive lung disease, then the oxygen level tends to really drop. Now, if you're sleeping like that and sleep for so long, the pulse ox also drops, and it
Dr.
may
Let,
drop to
Dr.
80 or something. Yeah.
let me bring on Dr. Omotosho, who had mild symptoms, right, that you have described, right? Let's go through how she managed her symptoms, and then you talk to us about, what we, if we notice the symptoms she's going to talk about, what we at home should do if we notice those symptoms. Mind you, she is not sure that this was a COVID situation, but then let's go through what she experienced. Dr. Susan, we welcome you to the program. Please go ahead and
Oh,
share your experience.
yeah, hi, thanks. Yeah, I'm an optometrist over here in the UK. And then what happened was that, of course, I was seeing patients. They were slowing down because the lockdown more or less kind of began. People were just buying crazily. Then my little son had a cough and then a fever, and I was watching it. Told him to stay at home. Then
Yes,
I now started having a cough. you
yes,
know. But still, I went to work. I'm like, this is my last week of work. I need to earn some money. I'm being honest,
yes.
because I knew the lockdown was going to be soon. So that day, I just took lots of throat sweets and water. I'm being honest. Managed myself that last week, which was between the 16th and 21st.
Yes,
So by the 20th, oh my God, I had the last day to work, which was the 21st. I had the bad fever, really strong. So I took lots of flu tablets, stayed in bed all day because I knew the 21st I was going to work. But on that day, because I see patients, I did not really go close to any patients, looking into their eyes. I kind of gave my distance
yes,
and just, looked at the pictures of their eyes,
yes,
just did a quick test, and they were out. And also fortunately, lots of patients were canceling because really
yes,
everybody was afraid of
yes,
getting the corona.
yeah.
So from that 21st, that was the end. Just like the doctor just described,
Yeah.
I was sleeping exactly the same.
You were
Could
sleeping.
sleep all the, yeah, sleeping. I was weak.
What about body aches and
Exactly.
pains? Body
What
aches,
is it?
body aches and pains. Did you experience?
Body aches, body aches. I was sleeping and sleeping. That's one thing he said, and a bitter taste in my mouth.
Yes,
And then all I really wanted, to be honest, were oranges.
yes.
I couldn't really do anything at all. Get up to, forget about it. I couldn't really, I was weak. So sleep was my friend. My mom will call from Nigeria. She'll send me a message, maybe on my WhatsApp. I'm very active on my phone. I'm always with my phone. So she might send me a message in the morning. She will not see any response. She will have to call me at midday. And my Igbo name is Uche. She will say, Uche, are you all right? I'll say, I'm okay. I was sleeping. I didn't really want to worry her by telling her that I was unwell. You
Yes,
understand? But
yes,
it's only now that I'm fully recovered, and now say,
that
Mommy, I have
you
a
know.
feeling I had a mild, corona or
Yes,
COVID-19,
yes,
because I was really poorly for over 2.5 weeks or so. I
yes,
think I got better by April 1st.
yes.
So
Now,
this was,
if you
huh?
don't mind me sharing, you have
Yeah,
friends and relations who are also in the medical field, and some got exposed and unfortunately took it home. This is the biggest fear for us medical practitioners, and it's such
correct.
a comfort to see Dr. Luya, who is a medical practitioner who has been seeing and who went through this, confirmed and survived to tell us about it. So it's such a big message of hope to us. So Susan, if you can share what happened, if you don't mind, what happened to your cousin who is a nurse and her family?
I'll just give us brief from all the things I've gathered. So she
Yes,
is a nurse a nurse practitioner in New York City.
yes,
Unfortunately, she got corona, the COVID-19.
mm-hmm.
So took it home, of course, unknowingly, which is
Yes,
unfortunate. So her daughter got it, her husband got it, unfortunately, and I think he had underlying
conditions.
health issues, yeah,
Yes,
health conditions, diabetes and high blood pressure, and unfortunately had to be admitted, and then and sadly got pneumonia, had the fever, had everything, and unfortunately just sadly died about 2 weeks ago. So it's so sad that
so sorry about
anybody could lose anybody. And I think it's quite high in New York, the deaths,
that.
and even the number of deaths in the UK is almost
Yes,
about, I think, 19, 20, going to 20,000 now.
yes,
So it's such a sad, and we just lost our friend's mom as well, just last Sunday. In
mm-hmm.
the UK, the same thing, had the fever. He's a consultant, so he
Mm-hmm.
was treating the mom at home. And then unfortunately, I think it got worse, affected her lungs. They admitted her into the hospital. Unfortunately, I think she did not meet the criteria for using a ventilator. So they treated her by other means, but they did not give her the ventilator. And unfortunately, we lost her on Sunday. So
Oh,
she was
so sorry.
81, very sad. And of course, as a consultant, as a doctor, you can imagine how he would feel.
Yes.
Because he thought he couldn't use his powers. He's a consultant here, and it's so sad.
Yes.
And of course, our Prime Minister as well, Boris Johnson, almost went. He said it could have gone. It could have gone either way. So
Yes.
loads of people, unfortunately, are suffering during this season. Yeah, very sad. Family, friends
Yes, we will
are
take
being lost.
everybody. Please be comforted. Everybody who has lost someone, please be comforted and hang in there. This too shall pass. Dr. Susan, I want to say thank you for joining us and thank you for sharing your experience. Okay, thank you.
My pleasure. Thanks for inviting me. God bless you. Thank you.
Feel
And
better.
you all, please, doctors, nurses, health workers, please stay safe. It's just a terrible time for everybody.
Yes.
And we wish you all the best. Thanks for all you're doing for everybody. God bless you all.
Yes.
Sincerely from the bottoms of our hearts, we really appreciate all that you're doing. God bless you all. And
Thank
please stay home, stay safe. And of course, you guys are working. Just please protect yourselves. Make sure your hands are clean. Protect yourself. God protect you all in Jesus' name. Amen.
Amen. Thank you so much. Bye-bye.
Yeah.
Dr. Nelson, that was quite a handful. Now tell us about your journey, the sleep of death that has been confirmed by the
Well, I mean, like I said, in my experience, and most of the people who I've spoken around with, and few people who have, a lot of people have taken care of, women do better in terms of signs and symptoms, and their outcomes are actually better. But of course, if you have, pre-existing, medical condition, diabetes, hypertension, heart failure, hypertension, and then liver disease or kidney disease on dialysis, the risk is exponential. So and the risk is much higher. And I knew one way or the other, I'm gonna get exposed, but I didn't think I'll get that sick. Now,
so how sick did you get? Were you admitted to hospital?
No, I didn't. And I'll tell you. So when all of this was happening, like I said, I had taken care of patients who had COVID. We've triaged them over the phone, taken care of them over the phone. I told some of them what to do. I'm sure a few of you have seen my videos. I've done interviews, with the COVID when it was just coming to US with regards on NAB TV. We also did the one where we put out an infomercial, doctors across the globe, from the UK, from US to Nigeria. We spoke in different languages, and I spoke in Pidgin English. Some of you may have seen that. And unfortunately, by the time that went viral, I was ill, so I didn't even know what was going on at that time. But that's so much effort that we had put out to let people understand that this thing is coming, it's real, and it's terrible, and it can be very severe. Now, for me, in retrospect, I look back and I said, why did I fall sick? I mean, this sick. Was it because I had just recovered from the flu? Is that why? Or possibly, I don't know. But then, I like I said, I exercise every day. I'm in good shape. I do the things that I do. But when I took ill, I knew it was until eventually I went to get tested. Now, for patients of mine, because usually you do what you've done for other people and apply it to yourself when the time really comes. So I had written something about this a while ago that I shared on a lot of platforms. I run a medical platform for the last 3 years with a lot of specialists and all that. And because I have a lot of network, that I do, I shared this as well. So initially, what to do other than the standard preventive precautions that you take, don't rub your face on your hand, wash your hands, social distancing and all that we put out there. But then the exposure you can still get.
Yes.
Now, I had said, when you get it, the paramount thing is to make sure it doesn't get to your lungs. So when I wrote what I wrote then, I wrote for adults and for kids. because at that time we didn't know how much or how well it will affect children, but thank God it doesn't affect them that much. And even if they get symptoms, they're doing well, and no
How did
big
you
deal.
prevent it from getting to your lungs, doctor?
Right. So this is what I did. I wrote then, the same traditional thing that we used to do back home with the agbo,
Yeah.
but here in the US or in the UK or in most developed countries, you can't have access to agbo. So what do we have? You use the Vicks, the
Yes.
Vicks or the methylatum,
Yes.
or for aboliki. Now, for me, the aboliki is way too strong, so I don't advise that to do. But for those who can handle it, it's okay. So what you do, you boil hot water. Boil water. Take 2 teaspoons of the Vicks or the mentholatum of the aboliki. Put inside the hot water, the steaming
Yes.
hot water.
Yes.
Now, before you do that, you also rub on your face,
Yes.
your neck, your chest, your back, your armpit. You understand? And then if you can, take a little bit, put inside your nose. And then with the hot water, make sure it's a plastic, container, so you don't burn yourself. And be careful to secure it. And then lean over and cover yourself with a blanket.
Yes.
Now, when you do, initially, of course, it's steam. The steam with the ventilator is going to come out. You release some, so you're going to breathe through your mouth and your nose.
Yes.
Like take serious deep breath.
But that
And as soon as you do that, you're going to cough.
Yes.
You're going to cough. As you cough, just cough the whole thing out.
Okay.
Because obviously that's the virus that's going down there, and you want to cough the whole thing out. And of course, if let me give you an analogy. If you have 50,000 viruses that just got to your lungs,
yes,
and you cough out 35, that leaves how many 50 there's there. So they may not do as much damage that 50,000 would do. So, but the more you do it, the more you cough,
yes,
the more chances that you're gonna expel a lot of all this things. You just cough all of them into the water, and of course that also helps with bringing down the temperature. I also tell with that description, I described it as pulmonary toileting. So what it is just like taking the hot water and the Vicks, going to your lungs and just washing the whole thing out. And of course, we also know that the virus do not like the heat.
Yes.
Because the airway, as you breathe in and all that, is much cooler than the other parts of your body because the air goes in. So and they love to thrive there. And then in the airways from nose down to the lungs, where you have the alveoli and all that, you have tiny villi, which are tiny hairs that help propel things and expel things, but they stick to those things and all that. So when you do that, it helps you push things out of your lungs and push them all out. So that's one of the ways, the way I had told a lot of my patients, because I have patients, like I said, I have patients everywhere, and I have elderly patients as well, and those who have high blood pressure, diabetes, coronary artery disease, heart failure, and all that. So at home, I told them this remedy so that they would not end up in the hospital. And thank God, all the ones that I took care of, none of them went to the hospital. They took care of themselves at home, and they were fine. Because one of the things that really happens at in hospitals, by the time you get there, one of the first questions they'll ask you, do you have breathing problem? No. And then they check your pulse ox. If you don't have it, you're fine. Go home and take care of it. Because over 75% of patients who get the coronavirus actually do well, and they can help manage it at home. So because of the overwhelming burden on the healthcare system, they want to be able to take care of the sickest in the hospital, because obviously the manpower and the human capacity for the nurses are less. And remember, nurses and doctors are human beings. A lot of them were getting sick as well and being staying home. So and then when you talk about the ventilators, we don't have that much to cater for the amount of people who eventually really come in. So I had advised a lot of my patients and in my community then to do that, and they did, and they stayed home and took care of it. So when I got sick, I did the same, and I was doing it 3 times a day. Now, but then this is something very peculiar, and I tell people this. You see, as doctors, we're with you 30 minutes in a day, 3 times in a month, once in 3 months. But guess what? You're with yourself 24/7. So there's nobody who understands you better than you. And you have to be in tune with your body, how your body works. So I've never had a pneumonia before in my life, But I noticed that for a short while, when I take a deep breath, it wasn't going deep as it should. Then all of a sudden, I felt some prickly pain, in my chest. And when I take a deep breath, it hurts. And as a physician, I knew that's what they call pleurisy. And I said, ooh, okay, this is beginning to take over my lungs. So obviously, I did that, and the pain went away immediately. I could feel it again 2 or 3 days after. I did the same, and it went away. So, but obviously, as at that time, we're on the Zitromax, the vitamin C, the zinc, and of course, the hydroxychloroquine. So, and I was taking all of that. But guess what? My fever just did not budge. My poor wife was panicking and everything else. But as soon as I do the steaming, I feel better, and then I run to the bathroom to take a shower. But it's so funny. In my experience, I usually take lukewarm water to take a shower all through the year, whether it's winter or not.
Yes.
But at this time, I have very low tolerance for hot water. But this time around, the hot water was so good. Jesus. I could stay in the shower for 30 minutes.
Yes.
30 minutes, because at that point in time, the pain, as soon as the water runs in my body, I feel no pain. So I'd rather just stay under the hot water and just stay there. So, but after 30 minutes, I'm like, you know what, I'm tired, I'm done. So, I'll try and go, and then the pain will come. So, but what I do again, I rub my feet, my back, my whole body with the Vicks, and then take a towel on, and then drink, hot soup or tea, and then lay down. You sweat, you feel better. Maybe another 30, 40 minutes or 2 to 3 hours. You'll be up, I crack a little joke, watch a little TV, and then
3 times every day.
Yes, I had to do that when
every day.
Right.
Okay. All right. So you isolated yourself, I'm sure, in this period.
Yes, I did completely. Because I have a daughter at home and an elderly, mother-in-law. So we had to.
You had to take a second test to show that you were negative before.
Yes, in fact, as a matter of fact, I intend to do the second test next week, this coming week. But unfortunately, I've been 2 weeks free of symptoms, which is really, peculiar, because these are my personal experiences and some of the things, because at this stage, we had no idea what works or what didn't. We were listening to messages that were coming from China and from Spain and from all that. And then the whole big, story of the hydroxychloroquine. We looked at the hydroxychloroquine. I read so much about it because I teach residents. We talked about that, the 3 stages and levels where it works.